What brought me to Mount Sinai South Nassau ER was on December 10th, the Friday evening. I wasn't feeling well, so very early on December 11th, 2021, I decided to go to the emergency room and figure out why I couldn't breathe.
We were called by the emergency room physicians. Her blood pressure was dangerously high. It was about 230 over 110. We did an EKG in the emergency room, which showed an electrical abnormality. We did an echocardiogram that showed that her heart was weak, so she did have heart failure.
I am very diligent about knowing my numbers, understanding blood pressure, understanding sleep. My diet has changed by continuing to understand what we're putting into our foods, but really paying attention to the scratch-based foods and the plant-based foods that I could incorporate more into my diet, reducing salt, of course. As far as exercise, I was really excited to learn how to exercise more effectively by being a patient at the cardiac rehab that's a part of Mount Sinai, and that was life-changing.
Beverly's prognosis is excellent. Her repeat studies did show that her heart failure did improve and her blood pressure normalized. She's taking care of herself. She's listening to her own body and her symptoms and basically putting herself first, which is really important.
Physically, Dr. Megalla has helped me understand how my heart should be functioning, what I need to do to follow up on maintaining good heart health. I'm an inquisitive person. I'm a curious person. I have lots of questions, and she's so patient, and she works with making sure that you can understand in a very grounded way what is happening to you and what you need to do next.
Many times women think that their symptoms are unrelated to their heart. Beverly, for instance, she was short of breath, she was tired, she was fatigued. She kind of attributed to her stressful lifestyle. So in her situation and in many situations, these symptoms are overlooked.
Before this happened to me, I never thought at all about having a heart checkup. Even going for a physical, an EKG never occurred to me as something that I needed to pay attention to. But I now view heart health the way I do health of other parts of my body. Your heart is a key organ, and this is what I learned through working with Dr. Megalla, and you should treat that as you treat other main organs, and you should get them checked out yearly.
So women should be going to their primary care doctor or any, their primary physician at least once a year. They should be getting their physicals, knowing their blood pressure, their blood work, checking their cholesterol. We don't want to wait until it's too late. And whenever people do have symptoms, it's important to seek medical care.
Why I would recommend Mount Sinai South Nassau, it's because of its accessibility in the community. It is because of its kindness. It is because of the thoughtfulness that goes into care for patients. So I would recommend it for the perspective of who knew in my own community where I live, right out here in Freeport, that there was this level of coordinated services, literally accessible, available, and just really so patient-centered and kind to people who are probably terrified. Nobody wants to be a patient. Nobody wants to be ill. But if you have to go through this kind of experience, you want to be treated with dignity and kindness, and that's how I was treated.